Hello and welcome back to my channel. Thank you for clicking on this video today. Today's video is going to be all about POTS. Now POTS stands for Postural Orthostatic Tachycardia syndrome, and it's likely that since you're watching this video, you're experiencing some symptoms, you're searching for a diagnosis, maybe for yourself or maybe for someone that you love, and maybe you've even already been to a doctor or more than one doctor trying to figure out what's going on with you, and you just can't seem to find an answer. Well, I'm here to shed some light today on exactly what POTS is. POTS is a form of orthostatic intolerance, and it is a form of dysautonomia. I have a video here on my channel talking all about dysautonomia in depth, about what it is and the symptoms to look for, if you'd like to check that video out. Now, POTS is associated often with excessive tachycardia upon changing positions. So you're laying down or sitting and you stand up and your heart starts to race. Now, the diagnostic criteria for this would be a rise in beats per minute by at least 30 beats. Now, this would be within 10 minutes of standing up. For children and adolescents, the criteria would be 40 beats per minute after standing up, and this would be within 10 minutes of standing. Now, there's a lot of symptoms associated with POTS, and a lot of practitioners, they tend to focus more on just the tachycardia as it's the most obvious symptom. But it's a really complex syndrome. There's so many different symptoms, and so we can't just always focus on the tachycardia. It is fairly common for POTS patients to have a drop in blood pressure when they stand up, but they can also have a rise in blood pressure upon standing. POTS patients also have a lot of times hypovolemia, and this is low blood volume, and this causes the patient to have a lot of the symptoms that we see and what I'm going to talk about. And this causes vasoconstriction in the blood vessels, including many of the systems in our bodies, such as the skin, the digestive tract, our kidney function. They're all affected by this. Some of the symptoms that you can experience with POTS, I've actually made a list here to read to you guys because I don't want to be stumbling over my words trying to memorize them. Even though I do experience a lot of them myself, I wanted to make a list, and it's not completely exhaustive, but there's a good amount just so that I can get that out to you guys. So many POTS patients can experience some of these, all of these, and much more. Some of them that I have recorded here are patients can experience fatigue, headaches, lightheadedness, heart palpitations, exercise intolerance, nausea, diminished concentration, tremulousness or shaking, syncope or fainting, coldness or pain in the extremities, chest pain, shortness of breath. A big one would be brain fog, which goes along with the diminished concentration. That's one of my huge symptoms, is brain fog and being unable to concentrate or even form a sentence. And then, I think I already said shortness of breath. I have that right now, just listing these symptoms to you guys. And then patients can also develop a reddish purple color in their legs upon standing, and this is due to blood pooling in the legs. So a typical person's autonomic nervous system, it's working fine, so their blood is, circulating through their body freely. It's going up through their legs to their belly, into their heart, to their head, and just, circulating, so all their symptom free. Well, they might have something else going on with them, but they don't have a lot of these symptoms. So because of that blood pooling, you have poor circulation, causing that reddish purple color when you stand up. A lot of times we get this in the shower if we're standing up. Some people also have fairly mild symptoms, and it doesn't really affect their day-to-day, so they're able to continue with work or continue with school and their social activities, and that's wonderful if they have a mild case. Where for others, their symptoms may be so severe and intense that they can't do even normal daily activities that most people take for granted the ability to do. So some of those things might be just bathing and showering. It's a huge task, and I know that sometimes it is for me, and it just it wipes you out and you're so exhausted afterwards. But even just the process of doing it, you a lot of times, like myself, need a shower chair so that you're able to sit down while you shower, because you get really lightheaded and a lot of people can faint. So it's just like a safety precaution and just a way to get you through that shower in a safe manner. Like I said, for those patients whose symptoms are so severe that it affects their daily life, some of the things that it also affects is, their housework. They're not able to, take care of their home like they used to. They need help. Even eating. A lot of times you don't feel like eating, and if you do eat, your digestive tract, your stomach isn't even able to really digest the foods that you're eating, so you just feel awful afterwards. Sitting upright can be a challenge. You're so fatigued and your heart can race just sitting there. Walking, obviously, or standing up, these things are difficult, and it's really debilitating and sometimes even impossible to do some of these things. So it's just a really complex syndrome. The degree of severity varies so much from person to person, as well as the symptoms. As far as what causes POTS, there's actually not a definitive answer for this. It's known as a heterogeneous syndrome, meaning that it has many causes. Now, the S in POTS stands for syndrome, and a syndrome is where there's a bunch of symptoms all clustered together. It's not in itself an actual disease, but it's fair to say that POTS is caused by something. It's caused by something, but it's just finding that something that is the hard part. Many people, along with their doctors, aren't able to find the exact cause for why they all of a sudden, because a lot of times it is all of a sudden or overnight, why they have POTS. And that is known as an idiopathic form of POTS, meaning of unknown origin. Now, sometimes you can have POTS due to a secondary condition, and working with your doctor and doing tests can help you see that maybe something else is causing it. And once you have that resolved or under control, your symptoms may diminish greatly, and even almost altogether go away. You're relieved. Anyways, that's pretty much what I have for this video as far as what POTS is. I'll be getting in depth more about the treatments for POTS, both naturally and pharmacological measures, in other videos, and I have a lot more lined up talking about POTS and chronic illness for you guys. So I really appreciate you watching this video. Please give me a thumbs up if you enjoyed it and you'd like to see more videos from me, and also please subscribe. I would really appreciate it. And also just leave me a brief comment or tell me a little bit about your story or why you clicked on my video and what's going on with you. I'd really love to hear it. So thank you again for watching. I hope you're having a wonderful day and staying safe, and I will see you in my next video. Thank you so much. Bye-bye. I also wanted to quickly apologize for any crying that you may hear from my little one. He started crying and you may have heard that in the background. Sorry about that.